As physiotherapists, we're always asked what are some simple, effective strength exercises. So what we're going to do today is demonstrate through the more common ones, in this video starting with the lower limb and advancing onto the upper limb in the next video. The principles for strength are always pretty basic. Strengthen the bigger muscle groups because muscles burn fat faster than any other body tissue. So the more strength you have in those bigger muscle groups, it's going to help you with the exercise anyway, but will also help with your cardiovascular fitness and for burning those calories too. The biggest muscle in the lower part of the body is the glutes or the buttock muscles. Broken up into three different groups, we have your glute maximus, which is the main strength one, your glute medius, which offers stability, and your glute minimus, again, that contributes a little bit to that stability. We're going to start with your glute maximus and probably two exercises that most people don't like, squats and lunges. So we're going to have Matt demonstrate here for us a squat. So Matty, we get you standing facing forward, feet shoulder width apart, toes and heels in line, both facing forward. And when we're coming down into the squat, we want to make sure that the knee is pretty much coming in line with your second toe. Really important we keep a nice straight back as we come forward, and the bend is coming from the hips, not from the back. So that's pretty good, Matt. As you get stronger and more stable, you really want to try to get the hips and the glutes down to in line with the knees. The lower you go, the further into range, the better muscle activity and strength you will get. Let's just get you turning facing towards the wall so we can get a side-on view of that. Pretty good, Matt. And we can go lower, and if you can, still keeping the back straight, lean forward into a little bit more. That's better, getting right down into it. To advance this, you can hold the weight or increase your hold when you're at the bottom of the squat. So from there, we progress into the lunges. So with the lunges, you take a nice step forward, good, bring that back foot back a little bit more, excellent. And we're going to keep the back straight again. We're going to drop through the back knee so that that knee is going towards the floor. We're not progressing forward with the lunge. The lunge is down and holding at the bottom, good, and straight back up again. So not too far forward, just nice and straight down onto that back leg, and you will feel the burn into the quadricep, probably on that stabilising leg as well. Great, again, let's get a side-on view of that one. So you can see there Matt's gone a little bit far forward. We want him dropping straight down onto that back leg. That's great, good work, Matt. Now, a common exercise we give out is for your glute medius muscle. It's commonly known as a clamshell exercise. This is more of a stability one. It is really important to get this exercise correct because it is given to 90% of our patients with lower back pain. So Matt, if we get you lying down on your side, facing towards the camera. Great, nice and straight through the body. We're going to have the legs bent up together, feet together, a little bit further behind, so the line of the body is meeting up with the heels down here. The glute medius muscle is where your hip pocket would be in a pair of jeans. So what we recommend you do is actually put your hand onto the muscle so you can feel where it's meant to be activating. We then recommend you slightly roll forward, almost as if the muscle's facing straight up towards the roof, so it's favoured by the exercise. The exercise is called a clamshell because basically we get the legs to operate like a clamshell. Feet stay together, and that's right, Matt, we're lifting at that top knee. Now you don't have to go too high. If you're going too high and you're twisting back through the hips and you're moving here, you're going too much, okay? We prefer a smaller, more controlled movement than a larger movement that's getting the wrong muscles activating. You will know if you're doing this correctly because you will feel the burn into the muscle right under Matt's hand there. We can advance this by increasing the hold or adding in some TheraBand for resistance, but your physio will be able to advise you on how to best progress this exercise because it is important that we get it right. Great. Let's get you up into the step now, Matt. And we're going to finish with the calf muscles, similar to the stretching video, broken up into your gastrocnemius and soleus. For your gastrocnemius, we're going to get you just a little bit more off the step so the toes are on there. Balancing on the wall is okay for this one. And we're lowering right down, heels as low as we can, and then up as we come. And that's going to get your gastrocnemius muscle. To advance this, again, we can increase the hold while we're up. If your balance good, you can have weights into your hands on either side as well. Now the advancement of this, and the one that's often forgotten, is the soleus muscle, which is the lower down. To favour the soleus, we bend through the knees. We try and maintain that same knee angle while again coming up and down through the feet. Now what you're going to see here with Matt is he's actually broken his ankle in the past, and that control and movement isn't exactly there. It's a commonly overlooked way of strengthening through this lower limb, and you can see how hard it can be. That's great, Matt, you can step on down. So what we've run through there is the principles of strengthening for the lower part of the body. If you're looking to advance or progress these exercises, come on in and get some advice from our great physios. Alternatively, we do recommend coming on in and joining one of our Pilates and exercise rehabilitation classes so that your whole progression of rehabilitation can be supervised in clinic.